USAID RenewHealth, expanding access to community-based drug rehabilitation in the Philippines. There are more than 1 million persons who use drugs or PWUDs in the Philippines. 90% of them are low or moderate risk users who can actually be treated in the community. Community-based drug rehabilitation, or CBDR, is an integrated model for helping drug users with mild severity of addiction. It includes a continuum of care from outreach and low-threshold services through active coordination via a number of health, social, and other non-specialist services to meet the needs of clients. CBDR includes screening, treatment, family support to recover, aftercare, and reintegration. Unlike inpatient treatment that is costly and may take away the patient from his or her family and work, CBDR can provide the needed treatment in the community. There are a number of challenges in CBDR implementation in the Philippines. Out of 1.3 million PWUDs, only 30 to 50% have been screened. This is due to an inadequate number of accredited doctors who can perform drug dependency exam or health providers who can conduct screening in the community. Low-risk PWUDs take lengthy programs even if international guidelines suggest that only brief intervention is required. There is also lack of evidence-based treatment interventions and trained personnel to deliver CBDR services. Due to these constraints, only 15% of those eligible for CBDR actually received treatment. In addition, PWUDs face stigma and discrimination, and therefore find it difficult to find jobs. Those in the Drugs Watch list remain unclear whether their names will ever be removed. USAID RenewHealth works with the Department of Health, Dangerous Drugs Board, Department of the Interior and Local Government, Department of Social Welfare and Development, and local government units to address these challenges. Our goal is to help persons who use drugs, or PWUDs, people in recovery, and their families obtain access to informal care, self-help, or community-based rehabilitation and recovery support to reduce or prevent drug dependence. Our objective is for communities to be able to provide evidence-based approaches and CBDR services that Filipino PWUDs and their families can access without fear or prejudice. The RenewHealth project is currently working with several partner sites in 9 regions. We hope to achieve our goal by 1. Improving healthy behaviors of people who use drugs, their families, and communities. 2. Fortifying the quality of patient-centered and compassionate CBDR. 3. Strengthening policies and systems for sustainable CBDR. We also support strengthening the ability of Philippine government institutions, as well as the anti-drug abuse councils, to deliver CBDR services. For the past 3 years, USAID RenewHealth was steadfast in achieving its goal. The USAID RenewHealth project follows the client cascade of reaching more clients and stakeholders to increase help-seeking behavior and support for CBDR. It focuses on helping local government units reach, screen, and treat more clients using appropriate tools and interventions. It assists partner LGUs in providing support for programs to sustain recovery. It also seeks to help institutionalize CBDR by providing health system support to its partners both at the national and local levels. Our milestones. RenewHealth project sites signified strong commitment to local CBDR implementation through signed MOUs. About 80,000 PWUDs from these LGUs have been reached. In partnership with DOH, the project created Lusog Isip, the first mobile application for mental health and self-care for Filipinos. The project assisted in developing screening, brief intervention, and referral to treatment toolkit. In partnership with the DOH, we trained 414 providers on SPURT and 107 trainers. As a result of combined efforts, about 59,000 PWUDs were screened. 1,880 community facilitators and health personnel from partner LGUs were trained. About 39,700 clients have been enrolled, and 18,700 of them completed treatment. With the Department of Social Welfare and Development, RenewHealth trained 162 key personnel and social workers in aftercare and case management. USAID received a Salamat Po Award from DSWD for these efforts. RenewHealth created the Barangay Anti-Drug Abuse Council, or Badak Aksyon Training. An online conference on drug policy and research was completed by the Asian Center for Drug Policy and the UN Office of Drugs and Crime with over 2,800 participants. In collaboration with the Department of the Interior and Local Government, the SICAP Badak trainings have been updated with the modules from Badak Aksyon, which will be cascaded in barangays all over the country via multi-agency regional and provincial teams. These milestones were made possible with the strong commitment of our national and local government partners. In collaboration with the Ateneo de Manila University, the World Health Organization, and the United Nations Office of Drugs and Crime, and our government and non-government partners, USAID will continue to support community-based drug rehabilitation towards a drug-free Philippines.